Nutrition science holds an outsized influence on public policy, shaping everything from national dietary guidelines to food labeling laws and school meal programs. But much of this science, particularly when it comes to long-term health outcomes, relies heavily on observational studies. These are the large-scale, population-based studies that track what people eat over years or decades and then look for associations with disease outcomes. They are foundational to our understanding of diet and health, yet they come with significant limitations that rarely make the headlines. And increasingly, this has led to a growing tension. How should we balance the insights these studies offer with the confounding factors they cannot fully eliminate? The core strength of observational studies lies in their scale and duration. They can follow tens of thousands of individuals across decades, providing a rich dataset that allows researchers to detect patterns, generate hypotheses, and spot correlations between certain dietary patterns and health outcomes. These studies were instrumental in linking saturated fat to heart disease in the 20th century, revealing the dangers of trans fats, and more recently, showing the harms of ultra-processed foods and sugary beverages. They are, in many ways, the backbone of public health nutrition. But observational studies also come with a significant warning. Correlation is not causation. People who eat more vegetables also tend to exercise more, smoke less, and have higher incomes. People who eat more red meat might also consume fewer whole grains, sleep less, or experience more chronic stress. Even when studies adjust for these confounders, many variables, like food quality, cooking methods, or underreported dietary intake, remain difficult to isolate. Self-reported food frequency questionnaires, a common tool in such studies, are inherently imprecise and vulnerable to bias. People often forget, misreport, or underestimate what they eat, particularly when it comes to foods perceived as unhealthy. Despite these limitations, policymakers frequently rely on the weight of evidence from observational data, especially when randomized controlled trials, RCTs, the gold standard in medical research, are difficult or unethical to conduct. You can't assign people to eat bacon every day for 30 years and wait to see who gets cancer. As a result, nutrition policy often rests on converging lines of observational data, mechanistic biology, and shorter-term intervention trials that track biomarkers like cholesterol, inflammation, or insulin sensitivity. When all these align, policy recommendations are made, but the underlying uncertainty often persists. This has led to public confusion and mistrust. Headlines about eggs being good one year and bad the next, or red meat being demonized and then redeemed, feed the perception that nutrition science is unreliable. But what's often changing is not the data, but how it's interpreted, and which confounding factors are being better accounted for over time. For example, earlier studies on fat didn't distinguish between types of fat, leading to overly broad conclusions that all fats are bad. More recent analyses, with better statistical modeling, show that unsaturated fats can be protective, while trans fats are uniquely harmful. The challenge for public health officials is walking the line between acting on what we know and waiting for perfect clarity. If guidelines were based solely on ironclad RCT evidence, they would lag behind emerging risks and fail to protect populations in time. But if policies lean too heavily on weak or flawed observational studies, they risk being overreactive or misdirected. This tension is particularly visible in the debates over dietary cholesterol, artificial sweeteners, or low-carb diets, areas where the science is still evolving. That said, the most robust findings in nutrition, like the benefits of fiber, the harms of sugar-sweetened beverages, or the risks of processed meats, are backed not just by observation but by biological plausibility and consistency across diverse studies and populations. When many lines of evidence converge, the signal becomes stronger, even if some uncertainty remains. This is why the precautionary principle often guides policy. When the potential harm is large and the cost of reduction is low, it makes sense to act even without absolute proof. Ultimately, observational nutrition science is an imperfect but essential tool. It highlights patterns that are too complex or long-term to study any other way. The key is transparency, acknowledging the limits, communicating uncertainty clearly, and combining observational insights with mechanistic data and short-term interventions. Public trust depends not on perfection, but on honesty, humility, and a willingness to evolve recommendations as better science emerges. Nutrition policy will always be a balancing act. But understanding how we arrive at the recommendations we receive and the strengths and weaknesses of the science behind them empowers individuals to make informed decisions, even in a field where not all answers are final.